there! Have you ever wondered how cutting edge technology is revolutionizing healthcare? Well, today we're going to dive into the exciting field of biomedical engineering. So, what exactly is biomedical engineering, you ask? Well, biomedical engineering is the intersection of medicine and engineering. It's all about creating innovative solutions to improve patient care, diagnosis, and treatment using various engineering principles and techniques. It empowers us to conquer the complex challenges of modern healthcare and pave the way for a healthier future.
Biomedical engineering is divided into many subdisciplines. Some specific fields within biomedical engineering are biomechanics engineering. This field applies engineering principles to the movement of humans and animals. Robotics and surgery. Robotic surgery is a rapidly growing field that has the potential to improve surgical techniques significantly. Robotic surgeons rely on robotics to perform minimally invasive procedures, which are known to have a lower complication rate than traditional techniques. Medical imaging. Medical imaging is an area of biomedical engineering that involves developing the technology for obtaining images of the human body, such as X-rays, MRIs, and ultrasounds. Orthopedic bioengineering. Orthopedic bioengineers can create custom-made orthopedic implants for patients that are specially paced for the patient's body. Orthopedic bioengineering is a new but rapidly growing field of biomedical engineering that provides orthopedic surgeons with a more technology, advanced, and effective surgical tool. Bionanotechnology, a relatively new branch of biomedical engineering. Bionanotechnology is the creation of devices and equipment that utilizes biological molecules such as DNA to produce medical devices, diagnostic tests, and other healthcare products. Bionanotechnology is still a branch in its infancy, but it could prove to be one of the most beneficial branch of biomedical engineering within the next several decades.
We interviewed Alex King, Regional Support Manager at BrainLab. Alex graduated from Arizona State University with a Bachelor's of Science in Engineering and received his Master's in Applied Biomedical Engineering from Johns Hopkins University. He is a biomedical engineer with 7+ years of experience in the medical device industry, providing clinical guidance for product use in surgical navigation applications, leadership and mentoring, and problem solving. Through this interview, he was able to give us insight on the road to becoming a biomedical engineer. Step 1. Earn your bachelor's degree in biomedical engineering or a related field. This includes coursework that covers the topics of biomechanics, biomaterials, medical imaging, physiology, and medical device design. Perhaps also join a lab, as this can help expand your knowledge outside of just textbooks and get some hands-on skills and different experiences. Step 2. Gain practical experience. While it's not required, seeking internship opportunities are great for growth and experience. This allows you to apply your knowledge and work with professionals in the field, as well as building both hard and soft skills, and even networking. Working at companies that offer internships like Medtronic, Johnson & Johnson, and Boston Scientific is helpful in making sure you possess a wide range of necessary skills in disciplinary areas of mechanics, fluids, computing, and electronics. Other important skills to learn are strong analytical and problem-solving skills, excellent communication and teamwork skills, attention to detail and accuracy, strong technical skills in engineering and biology, creativity and innovation, ability to work under pressure and meet deadlines, adaptability and flexibility. Step 3. Consider an advanced degree. Obtaining an advanced degree, either a master's or PhD in biomedical engineering, can open more opportunities for research, development, and leadership roles. Step 4. Get certified in your specialized area. While this is an optional step, obtaining certifications can demonstrate your expertise and commitment to professional development. Here is a list of some certifications that are available for biomedical engineers. And for the last tip, we'll let Alex tell you.
I was involved with the BME Society. I would say that's something that's really great to stay a part of, because that gives you all the latest updates, access to all these different conferences.
The top 3 universities that offer biomedical engineering programs is the Emory University Georgia Institute of Technology, Johns Hopkins University, and Stanford University. If you can't decide on what school to attend, don't worry. There are currently over 146 universities around the country that offer biomedical engineering, even here in Arizona. Now, let's talk about some remarkable advancements in biomedical engineering. One area that has seen tremendous progress is in prosthetics. Biomedical engineers have developed high-tech prosthetic limbs that can restore mobility and enhance the lives of individuals who have lost their limbs. These advanced prosthetics use sensors, actuators, and artificial intelligence to replicate natural movements, enabling users to perform complex tasks with ease. Another exciting application of biomedical engineering is tissue engineering and regenerative medicine. It's no secret that organ transplantation is a complex and challenging process, often hindered by donor shortages, but biomedical engineers are working tirelessly to develop innovative solutions to this problem. By combining engineering principles with biological knowledge, they are creating artificial organs and tissues that can be used for transplantation. These bioengineered organs have the potential to revolutionize healthcare, saving countless lives in the process.
In addition to artificial organs, biomedical engineers are also exploring the field of stem cell research. Stem cells have the incredible ability to differentiate into various cell types in the body, making them a valuable resource for regenerative medicine. Biomedical engineers are harnessing the power of stem cells to develop therapies for diseases like Parkinson's, Alzheimer's, and spinal cord injuries. This emerging field holds great promise for the future of healthcare, as it has the potential to restore damaged tissues and improve the quality of life for millions of people worldwide. Let's not forget about the incredible impact that technology has had on the field of medical devices. From pacemakers to robotic surgical systems, biomedical engineers are developing cutting-edge devices that are revolutionizing healthcare practices. Keep in mind these useful strategies you learned in this video as you pursue your career in biomedical engineering. Seek new challenges. Be willing to take on new and challenging projects or assignments in order to advance in your career. You won't be able to identify your core passion in engineering unless you challenge yourself to learn about different fields.
Don't pause your professional development. Learning is a never-ending process. For better opportunities, always seek new knowledge growth. Engineering is a vast field of knowledge, and it is impossible to learn everything in one lifetime.
Keep yourself updated on innovations. Engineering and innovation are two distinct terms that are related. Someone somewhere in the world is always working on some new technology. As a result, you must keep up with engineering innovation news. You should keep track of all the details of new technologies and their implementation for future growth.
Improve your soft skill. Work on what your soft skills because they are what will get you to where you want to go. Basic and corporate communication should be improved. The world's best and most innovative ideas will never make it past the drawing board if they can't be communicated effectively.
Accept both positive and negative feedback. To grow, you need to know about your flaws from peers, colleagues, mentors, professor, and yourself. Then take the initiative to correct them. Your positive review will encourage work and keep you motivated. Once you are determined about your progress, then negative feedback is always helpful. Identifying your weakest point and making it strong will be the key to your success.
Try to work on your managerial skills. Try to be the head or team lead or project manager. Managerial skills will also help you to learn word of mouth, teamwork, and managing your work-life balance.
Learn from your flaws. No one is perfect. Whether you are a student or a professional, making mistakes is normal. Learn and focus on your mistakes and learn something new and progress.
Identify your mentor. During college, you must have your favorite faculty to whom you can ask for guidance. After entering into your professional life, you should also have a mentor who can guide you. It can be anyone, your manager, your team leader, or your experienced colleague.
Know the business rules. Even if you are an expert in technical solutions, learning business is always a good idea. Business understanding will assist you in comprehending the client's requests to find the ideal business solution.
An exciting aspect of biomedical engineering is its interdisciplinary nature. It brings together professionals from various fields such as biology, chemistry, physics, mechanical engineering, and computer science. This collaboration fosters creativity and innovation, allowing for groundbreaking advancements in healthcare. By working side by side, these experts can leverage their diverse skills and perspectives to tackle complex medical challenges. It's through this teamwork that we can truly create transformative solutions that have the power to change lives.
So whether it's designing advanced prosthetics, developing medical imaging technologies, or pioneering regenerative medicine, biomedical engineering continues to push the boundaries of what's possible in healthcare. It's an ever-evolving field that holds great promise for the future. With each new discovery, we move one step closer to a world where diseases are efficiently diagnosed and treated, where the quality of life is improved and where the boundaries of medicine are expanded.
And that's the beauty of biomedical engineering. It combines the power of engineering and the compassion of medicine to create a world where miracles happen every day. We're just scratching the surface of what's possible, and I can't wait to see what the future holds for this fascinating and life-changing field.
So next time you hear about a breakthrough in healthcare, remember, there's a team of incredible biomedical engineers behind it, working tirelessly to make a difference in the world.